What's going on, family? I hope you're doing amazing. I'd like to clear up some notions on supplements. First things first, supplements are important, okay, especially with the sleeve. Now, we sell Bariatric Advantage products, but I want to be clear, you can source your supplements wherever you'd like. The reason we like Bariatric Advantage is because of the transparency. Their mother company is Metagenics, and you need to be a practitioner to purchase. And Bariatric Advantage products come from the same facility, which means you get the same transparency. What does that mean? It means you can look up the testing of the products. Okay, I'll give you an example. Here we go. This is what I'm talking about. I'm on the Metagenics website. I grabbed a supplement right here on my desk. Look up the lot number. There it is, right there. You have all the results, the testing. Pass, fail, everything that's done, potency, etc. And that's what I call transparency. The issue with bariatric supplements, particularly the multivitamin, is that they are formulated for bariatric surgery. Some vitamins and minerals are elevated compared to what you'd find over the counter. Okay, so if you looked up the ASMBS guidelines on supplements, you'd see that you would need 3 to 4 pills to hit one of the bariatric multivitamins. That alone can cause nausea if you're not used to it. Make sure you have it with calories, a shake, or a meal that will buffer that potency. And that goes for any one-a-day bariatric multivitamin, which is why I say you can source wherever you'd like. Just like you can take any protein you'd like. We recommend Premier and Protein 2.0 because it meets the criteria, but it's also widely available considering we have patients from all over the country. But I know not everyone likes them, which is why you can source wherever you'd like. Now, if you can't tolerate the multivitamins at all, then go ahead and take an over-the-counter multi or even a children's multivitamin. Something is better than nothing, and you can always work your way up. Okay, not to mention you are eating food. Remember, the sleeve does not yield malabsorption, unlike the Roux-en-Y, bypass, SIPs, duodenal switch, or procedures like that. As for everything else, you can get over the counter. The difference with bariatric supplements is that they are accommodating for bariatric surgery, i.e. the dosing is in accordance with the ASMBS guidelines. Formulation is the formulation is for best absorption. You can find everything in a chewable form, and even the sizes are accommodating. Okay, like the omega-3s, the calcium, which are typically horse pills. If you hate the chews, you'd find them half or a quarter of the size, and you'd have to take 2 instead of 1 horse pill. Otherwise, if you are loyal to a brand, you don't have to be unloyal to your brand. So, on the opposite side of that spectrum of transparency are the patches. There are patches made for everything recommended, but they are not as good as oral, period. The studies don't support the efficacy. To be completely transparent, I don't think they work at all. But the fact is, Siri, Alexa, Google, they all know about your journey, and you're going to get all the ads on the patches, okay? Testimonies are great because you don't feel nausea. It's so much easier to patch it on and bypass the GI tract completely. And like I said, the sleeve does not yield malabsorption. So if you are using the patches and your labs are good, remember, you're still eating food. Damn near every flavored drink now has B vitamins. Any other bariatric procedure is malabsorptive, okay? You'd know firsthand if you're not getting the supplements you need, and anyone who's had the bypass or SIPs with us and opted for the patches and spoken to me 3 months later will tell you the aggressive approach we had to do to mitigate those deficiencies. To be honest, it doesn't even make sense how something is easily broken down as vitamins to be absorbed in an area designed to protect you, which is your skin, okay? Can you imagine if everything our skin touched ended up in our bloodstream? This is why you can take mineral-based sunscreen at, all summer long and not have a zinc overload. This notion does not take away from hormonal patches like estrogen or testosterone, nicotine, certain pain medications that have proven scientific efficacy. Okay, there are companies trying to develop this technology, but it's not supported in any literature yet. Okay, huge barriers to maintain bioavailability and cross the lipid layer of the skin. I'm sure there are ways to break large molecules into nanoparticles, or possibly use tiny needles to poke holes into your skin to penetrate that deeper tissue, electrical stimulation, or microdialysis. But I'm pretty sure a $2 vitamin patch is not going to provide any of that, okay? Now, I'm not gonna lie. We used to sell the patches because of the demand. We also sold a ton more brands, but took them off the shelves because of that transparency and don't want to simply sell you a product for the sake of selling you a product. We want you to succeed and won't set you up for failure. At the end of the day, take your supplements that best suits you. The brands themselves are suggestions based on the trust and science, as well as a platform to purchase, but not required. Okay? But that's pretty much it. That's my rant, and I will see you guys in the next. Peace.